go back and start from the beginning, and then that way we can go through all the different procedures. No, I won't wear a mask for that reason, that you can hear me. Okay, so we'll take the mirror probe. Just going to check the tooth. I'm just going to indicate to Lynn that I'm ready. She's going to give me some numbing cream. Give me some numbing cream there, Fred. Okay, just going to give you a little sting here, Fred.
We moved the cat.
DA can. Yep, DA can. Yeah. So if Lynn was to do that, if she passed it, she can take it and pop it over here, wherever you're going to put it, and then I can do the injection.
And that's it for me.
And then she's not going to touch it then. I will go over here and do and remove my sharps. Yep. So Lynn's just going to rinse the taste away there from the local. And again, that also stops the patient from sitting up to have a rinse. We can keep them in that same position. Okay, so we might just get started there, Fred. We'll just check and make sure that's nice and numb for you. Can't feel anything there? Beautiful. Beautiful. Okay, so we're just going to do a little bit of... Hey.
Oh, I could just use that one. It's only on the mannequin, yeah.
Oh, yeah. So I'm like,
yeah. It's like...
We normally do that activity for infection control, mate. So you're doing it now.
That nothing happened, because that's the one thing you can't like go and get the new rose and then they've got to like wipe it and everything.
The whole procedure has to stop, doesn't it?
Yes, exactly. All right. So we're just going to start doing our filling here.
I'm going to be a tooth behind, and I'm going to be keeping an eye on the mirror. Any splash or anything, I can just keep that nice and clean.
So you can see there that I'm drilling on the 6. Lynn's holding the suction on the 7. So she can still get the bulk of the water, but it's still allowing the water to go onto the burr first and hit the tooth. So she can still get the bulk of the water. Okay. So now we can, with this one, if we're using a single-ended probe, but we'll use this one just to show you, that you can, yeah, it's a perio probe, so that's okay. What we can do is we can get the DA to just hold the handpiece with the 3 fingers for this one. So I can go in and check my margins. I can give that back to Lynn and take the handpiece. She's going to put the handpiece down. There we go. Do it again. Okay, thank you. So you can see with that movement itself, you know, that's saving you putting this down a couple of times and also readjusting with your loops if you need to. So that can save you a bit of time as well. Okay, so let's go with, what have we got? Etch. I'm just going to put on some etch. I'll get you to rinse that for me, Lynn.
You can also see there, I'm coming in as close as I can to the face, so then Kathy doesn't have to reach over too far.
And if I can see it in my, peripheral vision there, I don't need to adjust my eyes either. I'll get you to rinse that off for me, Lynn. Lovely. Just get a cotton roll, please.
Have you got one? Yeah, thank you.
Sorry.
Thanks. Yeah, it's never, not going to happen. you.
We normally pick them up at the end of the day and shake out the cotton rolls, don't we? So same again, then I'm just going to hold that until Lynn brings me my next thing that I need. I'm just using bond, conditioner, whatever we're doing. Bond.
And I know that we'll be putting the composite in next, so I'm going to have this ready and Kathy can just hold that while she waits.
So Lynn can cure that for me. So at that point, if she's curing, I can also do some of my stretches.
Normally, when my DA is curing, I change from my prep burr to the polishing burr.
Good, excellent. Yep, beautiful. Yep.
And then if they're still curing, I'll take all my sharps.
Oh, excellent. See, and that's the idea that, you can do that then because you know that the curing's going on. So you can see here also with Lynn's wrists here, how nice and straight Lynn's wrists are. So if we're curing on the upper, she's going to use her left hand to cure. And if we're curing on the lower, she'll use her right hand. So again, she's not, doing the bended wrist to try and get there. Swap hands if need be. But also your tips on the curing lights turn around as well. So don't try and, get in like this. Turn it around to get in. So adjust your equipment, not yourself. All right, so we're going to place some composite now. Okay, now this time what we're going to do is just show you that instrument transfer and passing the instruments back and forth. So if I need my flat plastic and ball burnisher, while I'm moulding up the composite, you can see there that I don't need to move my eyes. Lynn's bringing the instrument in for me. And I'm just indicating to her that I'm done. And you can see there how she puts that instrument back into my hand with the working end of the instrument pointing towards the tooth that I'm working on. So I don't even need to, turn my instrument around. So I indicate to her that I'm done. She brings it back for me. Done. Now you can see how Lynn is walking that instrument as well. It's so she can give me the same working end back if I want it that way. Okay. So she takes it in the pinky, palms it so it's nice and secure, opens the hand up. It takes it, palms it, opens her hand up, grabs it with the thumb and index finger, moves the fingers along. So you can see the instrument doesn't move one bit. And so she's passing me back the same working ends that I want. You might not need to do that all the time, but it's a good habit to get into because then you can put your instruments back down that way as well. All right, that's lovely.
Let's take the cotton roll out.
I'll take the cotton roll out.
It's down probably.
Yes, found him.
Neck.
Right, so we'll just do some tap, George.
George today, huh?
George. Fred a minute ago. It'll be evident on the video that the patient changed his name halfway through treatment. Okay, so we're just going to adjust that there for you, Fred. George.
You can see here that I've just popped this miller's forceps in the back of my, in my hand there. So I can still be keeping that clear. And then I'll just go like that.
Tap, tap, tap.
Or the other way that you can do it is just if you prefer to be doing that yourself.
So again, if you prefer to do the articulating yourself, then again, DA can hold the handpiece for you. So you can tap, tap, tap. It just means you're not going to go back up and down all of those times. The other thing is when we do that handpiece one, make sure for the DAs that you're grabbing it with your 3 fingers for that one, and we're not going to adjust it at all. We just leave it in the 3 fingers. Dentist will come back with the instrument. Okay, so we don't try and turn that one around or move it around. We just hold it because it's a bit heavier. We hold it just there, and we'll go back in and out with that one. Okay, all right. So the filling is beautiful.
Thoughts?
I know you would expect nothing less.
I'll take that. Oh, you're going
Sorry.
to do the full mouth ring.
At this point, you like to put the intraoral portrait.
Yeah, that's fine.
Yeah.
So do you do your photos laying down or sitting up?
Laying down.
Laying down. Okay,
Just
then.
Intraoral.
Yep, that's fine.
Just the small intro camera?
Yeah.
Or do you want them to demo?
So
Maybe open a page, like a test patient, so they can see what you mean. Are you talking about this one, Winston?
Yeah.
So the DA will put everything down. Get the.
Yeah. Well, I still think that it might be best to do your full mouth rinse first.
Yeah.
Then the DA can put everything down and you can do your photos. Yeah. Because then the patient's got a nice clean mouth as well. Yeah. So let's do the.
Can that actually sit in there?
Yeah.
Yeah.
So you have it
Because what I
sitting in a drawer first.
Yeah. So what I
if you
ideally
use it every time.
would ideally have everything in there, and you see how I moved the
White
curing
curing light.
into there as well.
Mhm.
So then you really shouldn't have to go up onto the bench at all.
Yeah. And like I say, because every time you go up onto the bench with dirty gloves on, you're extending that contamination zone as well. So we want to try and avoid that.
And I try and avoid changing them as well.
Yes, exactly.
All
All right, so we'll do a full mouth rinse. So I'll retract for Lynn.
I'm
So
going
we'll
to
do
start.
that quadrant first.
I'll start in the midline up here, quadrant 1, quadrant 2, quadrant 3, quadrant 4. So with the spray, if you just have it on like a light spray if you can, just like that, you're going to be sitting probably about that far off the teeth. Don't go too close because it's going to spray everywhere. About that far around like that. If you're just doing a filling, you can just do the occlusal surfaces like that. Follow it around. Midline again, down. Midline, down. If you were doing a prophy, you perhaps do all of the surfaces. Okay?
Yeah, so if you're doing a prophy, you'd probably go buccal, lingual, buccal, palatal.
So if we're using like airflow as well, I mean, actually, I guess it depends
Oh
on.
no.
Oh,
See?
see?
Yeah.
Told you.
Yes. It's a zipper. Yes, so sorry, Francis, what was that one?
Because normally I'll use the airflow first and then I use the ultrasonic scaler after, because then that's just clean water and then they don't, because I used to do ultrasonic and then airflow and then I had to do the full mouth rinse, but I was like, okay, I'll do ultrasonic after. I usually do actually a bit of a rinse after because they might have some like calculus or something.
Sometimes, yeah.
Yep, that's fine. And that's why when you go through these, and particularly today, have a practice of those and see how it feels.
Like the DA can try doing full mouth rinse and also, I think I don't like too much of I do like fluoride. I do the fluoride as well, but they could definitely probably do that.
All right. So you have to use a keyboard. You can't press. Okay. So you can't press it on the actual thing. You've got to.
No, because it. I think
Here we go.
you can just
Move now.
Or just do. Okay. Cool. Yeah.
So are you doing the camera or the DA?
DA's doing it.
Then just holds it. DA clicks the button.
Okay. So in that case, DA could actually, if you've done your full mouth rinse, could put your suction down, take your gloves off, hand hygiene, and be clicking the buttons while you've got the camera even.
We changed the.
Oh, you've got a mouse pad?
anyway.
Perfect. Okay. Perfect.
Change that, yeah. So it doesn't matter.
Perfect.
Yeah,
So that's fine.
that's a good idea. Yeah.
Perfect. Lovely. How nice dummy teeth there. You can see how good my filling is. Ha. I love the photos though. Do you do photos? Do you do the intraoral photos for the patients before and after? Yeah. Because I know that I find that as well, that, with patients, when you show them an x-ray, means absolutely nothing to them. But if you can show them the picture where you've got the big dark, lines or grooves or whatever, it makes much more sense to them. And then the same then at the end, you can show them the picture of the restored tooth. And like, oh, okay, that's better. Yes.
Has anyone got any other questions? Anything you want me to show you again while I'm here?
Can you show me how you like here on this side?
Sure.
left hand for the top.
And so you can see as well that if need be, you know, adjust your tip.
I've got
So remember to
perhaps
adjust your equipment, not
like in the
yourself.
inside, something like that.
We've got buckle. Just
Yeah.
Yeah, so try and adjust your equipment, not yourself, because that's when we find, and we see it with DAs all the time, where you're like trying to get in like this, you know, and that's what, as soon as you start moving
And you may
too
just
much
need
to one side, remind yourself,
you know,
I shouldn't be going there.
rather than tipping like that, I would use sort of more my whole
Body.
core.
Yep.
Like that.
Yep.
Yeah, and really trying to use more your core than like
That
like
don't
that.
dip the shoulder.
Yeah.
Yeah. And the other thing is remembering that, you know, if you do need to move slightly in the surgery, that this chair moves as well. So you don't need to be going like this to try and get something, because then you're doing a full class 5 movement, and that's not good. But, you know, even for the clinician, you know, you move over and you turn around and do it and then come back.
Instead of going like that.
So you're not doing these big swifty swinging movements.
Yeah.
Anything else? All good?
No. And then as you can see here, that everything's sort of put back into its place. You know, basically back into its place of where it was.
So ideally at the end, we've not got, you know, what we've probably seen sometimes, Winston, I'm sure you're guilty of it occasionally. Joking, Winston. But, you know, I'm sure you're all guilty of it. Sometimes you'll look at the tray over here and there's gauze and there's things and it's all over, and the instruments are everywhere. And that immediately becomes an infection control sharp hazard as well, because you can't see what you're looking for.
that's me.
That's you? Yeah, see? I knew it. Picked you straight away, Winston. But it's true, because you drop things, you're not looking at where you're putting them. And then if you then go to get something, you risk, you know, giving yourself an injury as well. So that's what we want to try and avoid. But the DA can put the things back there nicely. Then again, if this is you here and you want something, you can go in and get it. You know, it's not like we're saying you're barred from that now. It's like, okay, I need that ball burnisher. I'm just going to grab that and keep going.
If the DA is mixing or doing something else,
and you need something,
stop them. You can just grab it yourself.
Grab it.
It's
actually easy.
need the 3.
You don't, no. And if you decide at some point that you really want to go with this and have everything here, you know, you can always take this off, because then it's something less you've got to clean as well. So remembering that anything that's in this zone, you know, has got to be cleaned, even if you don't use it. So
I just said I found really helpful when if the DA sees me picking up the ham piece and it doesn't have a burr on it, and they just like bring the burr kit over.
Yep, that's fine. Yep,
You could always just have the burr kit up there.
Yeah. And that may be something. Where do you normally keep the burr kit?
In here, but I could reach it there too.
Yeah. Okay. Good. Yeah.
But yeah, it is one less thing you have to, and think of all this too. Like you could save on, all of that.
Yeah.
You know, for you cost wise and environment.
Yeah. And even if you wanted to keep this, you could just put the bib there.
Mm-hmm.
Yeah.
You wouldn't need the tray and the plastic there. You could just put a bib there.
Yeah.
I think we were doing that at first, and then we weren't used to it yet. So I would still end up throwing a lot of stuff up there, and then the DA's grabbing them individually. So I was like, oh, let's just put a tray so they can take the whole thing.
Yeah, work it out as what you need. Yeah.
Yep. And, you know, that like is something that the DAs can work on as well. Say, you know, just remind you, I'll take that for you. You know, just that little reminder, because then you're taking it, bringing it back here. Because then at the end of the procedure, that saves you so much time as well, because you're not having to get all this stuff over here. You know, if there's just a bib there that you've got to grab on your way through, that's great, instead of having to actually grab stuff and take it back.
Shana's really good at reminding me, like, she'll have the other one and she's got her other hand out. She's like, come on.
Yeah, exactly. That's what we do. That's our job.
And we do that regularly. Well, not regularly, but, you know, but being known to do it, where you're holding something for the clinician and the clinician's asking you for something else, and you know they actually need what you're holding first because you've been doing it for a long time, and the clinician's saying, you know, bond or whatever, and you've got the edge and they're saying bond, and you're like, itch, itch. And then some that a penny will drop. Oh, okay, thank you. You know, keep going. So, but you know,
It's
occasionally
teamwork,
you
good
might say,
teamwork.
you know, oh well, I've got the etch ready. You know, and they're, oh, okay, thank you. So we're not ever going to say, you know,
There might be more
Winston,
worried
you
about
need to do this first.
more
But
worried
yes, of
about the
course.
margin or the, you know, bit of something
Yeah.
that's not
And it is true, because when we are doing our jobs as the clinician, you know, my priority is my patient. Okay, so that's what I'm worried about. As the DA, your priority is to look after anything else that's happening here. So my priority is always going to be the patient. That's what I'm focused on. That's what I'm working on. So I'm not necessarily thinking of those 5 other things you're thinking of. I'm just thinking of what I need to do for my patient. And if it's a difficult patient, you know, you're trying to, you know, maintain moisture and keep the field dry and whatever, you keep the tongue out of the way, keep the mouth open, whatever it might be. So that's what I'm really focused on. And so, you know, occasionally you may need to just, you know, say, I've got this for you, or whatever it might be, just to remind or, you know,
job then is
refresh.
to be thinking 2 steps ahead. You're 2 steps ahead of what the dentist is actually doing at that time.
Yeah. So I want for the DAs, make it your mission to always have something to give the clinician. Okay. So whatever we're doing, you know, be thinking, okay, what's next? And this is why your lists, your procedure lists are so great, because you can have it then and you can say, right, okay, so we're doing this now. I'm going to get my etch, my conditioner, whatever, ready to go, because I know that they're going to need that in 2 steps. So that every time you take something from the clinician, ideally you should be giving them something back. If the clinician has to wait for a second or 2, 10 seconds or whatever, while you're mixing something or preparing something, that's fine. You can say, I'm just getting the whatever ready, you know, so as long as that communication is always open as well.
I wanted to talk about that too, sorry. So you're normally, you mentioned earlier that you're using the slow speed suction to retract. So what did you think about using the triplex? Do you think that that might be?
Let's have a try with it
So
today and see how you go.
We can always just use this as, yeah, I can just either just hook in there up underneath the patient's arm, perhaps like that.
But if I'm doing a filling, I'll put the bite block in, and the slow speed suction is connected to the bite block.
Perfect.
Yeah.
Perfect. So then with the retraction, remember that before you put your suction in, you're going to retract, okay? And then you're going to put your suction in like that. Tongue, you've got the tongue down there, you're going to just retract and in.
Suction in.
Okay?
And remember as well that when we're doing that, not to have your suction on when you're going in, turn it on when you get in there. Okay, because if you've got it turned on, then you've got the chance or the risk of, you know, sucking up a tongue or a chin. For the clinician, it's a good idea for you to allow the DA to get her suction in first. Okay, because if I'm ready here in position, you know, it makes it very difficult for them to get in. So I'm going to say, we're ready to start. DA can come in. She can get in her position, ready to go.
Going down here now.
Yeah. And then I can come in with my mirror and start
inside of the tongue or whatever, or if it's up here, I might be there.
Yep. So let the DA go in first.
Any tips? Let's say we're preparing the lower right. Any tips for controlling the tongue? Affecting the tongue?
Well, yeah.
Hammer to the patient's head. No.
No, I mean,
and it's one of those things that, the triplex can be a little bit firmer.
Or I've noticed you've got another mirror.
You know, 2 down.
Have the mirror for the DA can hold the mirror.
Mirror.
To track the tongue.
Yeah, so
each we've got
either
the slow
either.
suction in somewhere else. They
can use that.
the
Good.
mirror and then the
I like that. I like that
Or
idea.
otherwise they can, if they're holding the slow speed suction, I'll tell them to put that like down in between the tongue and the teeth first, and then the high speed, because the slow speed you're not going to suction up the tongue.
Yeah, and it can just be just lightly on the tongue, and if you sit your suction on top of the triplex, then you can sort of push it down a little bit more.
Yeah.
So that will.
So don't try and get on top of the tongue and push it down, because if you do, they're going to push it straight back up.
Yeah,
So go
you
all
can
the way
just-
over the tongue and sort of slip your suction down in between the tooth and the tongue, and then pull back. They'll have less resistance. If you try and push the tongue down, they're going to go up. So yeah, so go on and sort of go back that way rather than trying to go on top.
And just be mindful if you're retracting around the front here, just don't go down onto the actual
The gum.
the gum. Yeah, because that can hurt a little bit. So just pull it slightly like that. Yeah.
And you may get that patient say that sometimes, oh, you're hurting me, but it's because you're rubbing on the gum and the bony area there, and they can feel it. So just remember that as well.
And that's anywhere in the mouth, really. I think just
even with the mirror, like if you push the mirror too hard against the gum, or
absolutely, it's very
because it's really
tender.
only that light layer of
and
skin
you
there
don't
on
feel
the
like
bone.
you're pressing hard, but for them,
Yeah, that's right. It's very tender.
And the other thing is with that as well, that when you are suctioning, retracting, those sort of things, remember to keep it gentle as best you can, because if the patient is numb as well, they won't feel it at the time. That, you know, if you're pressing firmly against something or grazing something, they won't feel it because they're numb. They'll get home and go, oh my God, I've got such a sore gum here, you know, or whatever it might be. So just, you know, keep that in mind that they are numb, because you think, oh, it's not hurting because they're not saying anything, but quite often they're numb and they might not be feeling it.
And sometimes also with the suction,
something like the tongue or the cheek, you can usually, like if you've got it all the way in and it's not like touching their lip, you can pull quite hard, but then if it's on any of the like where it's
surfaces, yes. Yes, be gentle there. Yep.
Some DA will be retracting quite forcefully, and then patient.
And then the patient moves their head towards the DA,
So how you counter that?
So again, what were you going to say?
I was just going to say too, with the suction, sometimes it doesn't have to be on the teeth, or it doesn't have to be on the gum or the tongue. There's enough power in this just to sit above
in the area as well.
In the area and get the water without even touching anything. So you're not going to touch the palate. You're not going to touch the tongue down there. You're just going to have it in that area that it's going to automatically go up in there. So just very lightly, gently in there like that.
Yeah.
And it just picks it up.
And particularly in the lower area, because if you're working on the lower back teeth, the water's pooling in that area anyway. So you're not going to need to go back to get the pooled water. If you've got your suction down there, you're gathering that pooled water anyway. It's only if we're working on the upper teeth that you may need to go back down to the pooled water. But again, if you've got your bite block with the slow speed suction, or you've got the slow speed suction in there, that takes that pressure away from you as the DA. You're not constantly thinking, oh God, I've got to go back down there and get the water out because the patient's drowning on water.
All right, your go, I think.
Yes. All right. So now do you want to have a go of your procedure? Or do you want to have a